Soft tissue lesions of oral cavity in children. The most common soft tissue lesions of the oral cavity in children are listed here. Eruption gingivitis is most common in children of 6 to 7 years, when permanent teeth erupt, especially the first and second permanent molars. Gingival margins receive no protection from coronal contour of tooth, and the food debris and bacterial plaque collect around and beneath free tissue, partially covering the crown of the erupting tooth, hence causing inflammation. There may be pain, redness, swelling, bleeding on probing, anorexia and dysphagia. The inflammation usually results on its own on complete eruption of teeth. Plaque-induced gingivitis usually happens due to poor oral hygiene, and is mostly reversible. It can be classified as early, moderate and advanced. Good brushing and flossing technique are often remedial. Favorable occlusion, and chewing of coarse foods such as carrots, celery, apples may help. Herpetic gingivostomatitis mostly occurs in children below 6 years of age. It may present as fiery red gingiva, malaise, irritability, headache, pain with eating and drinking. The yellow or white liquid-filled vesicles may rupture to form painful ulcers, covered with whitish-gray membrane, with circumscribed area of inflammation. The lesions may be seen on the buccal mucosa, tongue, lips, hard and soft palate, and tonsillar area. The treatment includes topical application of anesthetic gel before mealtime, bed rest, isolation from family, systemic antiviral and analgesics. Recurrent aphthous ulcers are discrete or confluent lesions, with oval crateriform base, and raised red margins. It may be caused by autoimmune reaction, trauma, allergy, salivary gland dysfunction, nutritional deficiency, and cheek bite. The treatment includes topical anti-inflammatory gels, creams, ointments, topical corticosteroid, topical anesthetic agent, and topical tetracycline. Acute necrotizing ulcerative gingivitis occurs in children between 6 to 12 years. It may cause inflamed, painful, bleeding gingiva, poor appetite, fever, malaise, and fetid odor. There is involvement of interproximal papillae, and presence of pseudomembranous necrotic covering. The treatment includes subgingival curettage, debridement, and use of mild oxidizing solution. Improved oral hygiene and chlorhexidine mouth rinse may help. Acute candidiasis is caused by Candida albicans, a common inhabitant which can rapidly multiply in hosts with low immunity. The lesions are white Kurdish-like on the buccal mucosa, tongue, palate, and gingiva. Lesions are difficult to scrape off, and may bleed easily. Mild cases need no treatment, moderate to severe cases are treated with antifungal agents. Scorbutic gingivitis is caused by vitamin C deficiency. It causes the gingiva to become bright red, swollen, ulcerated, with spontaneous hemorrhaging. The treatment includes complete dental care, improved oral hygiene, and vitamin C supplementation. Frictional keratosis presents as corrugated gray or white patches due to constant rubbing of the mucosa, due to traumatic toothbrushing or forcefully rubbing the tongue against teeth. The treatment includes removal of intraoral irritants and discontinuation of the causative habits. Irritation fibroma presents as fibrous connective tissue hyperplasia, due to chronic trauma. The nodules may have smooth or ulcerated surface, with a color same as the surrounding mucosa. Common sites are buccal mucosa, labial mucosa, and the lateral tongue. The lesions are treated with conservative excision. Pyogenic granuloma are benign lesions developed due to chronic irritation, trauma, and hormonal causes. The lesions present as nodules, few millimeters to 2 centimeters, bright red in color, with smooth surface. Common sites are maxillary anterior labial gingiva. These lesions surgically removed or with cryosurgery, electrosurgery, and laser excision.